Hi friends, in this video, I would like to discuss about some specific rehabilitation for sacroilitis. All of us know the first phase of rehabilitation in sacroilitis includes 90-90 posture. In this particular posture, in the flexion of hip and knee in 90 degree is the best exercise to start with sacroilitis. In this particular position, with the height of a stool from knee to hip is selected and the patient's calf should be rested on this particular stool or chair for a period of 10 minutes. This is a very good and ideal exercise to start with sacroilitis. In the next phase, we can give isometric knee push exercise. In the very next slide, I will show a video of the same. And this exercise is also very good modified SALABHASANA. I will show the video of that also. And this particular posture, bird dog, and this particular pressing back and pulling forward, both these postures are good for sacroilitis. But after 90-90 posture, for a period of 1 week, we can start this isometric knee push and modified SALABHASANA, which are very good exercise, which is very much better than these two exercises. Okay, we can see the video of the most effective exercise of sacroilitis, which is to be started after 1 week of 90-90 posture. In this particular rehabilitation, isometric knee push exercise, patient's one knee is flexed to this particular position and ask the patient to flex the hip and resist it with one hand. And that hand should be placed over distal end of quadriceps like this. Here we can see it is very much clear. Ask the patient to do hip flexion against resistance in hip and knee in 90 posture, 90 degree posture. Please ask the patient to avoid a support. The patient should actively do this and he should not keep a stool just like 90-90 posture while we are doing isometric knee push. In the second exercise, which should be taught, ask the patient to hold over hamstring and ask the patient to extend the hip and knee. And the patient should resist it with one hand. This is the second exercise. First, we ask the patient to do hip flexion against resistance. In the second exercise, we ask the patient to do hip extension against resistance. And then ask the patient to do it simultaneously. Ask the patient to do one hip flexion and other hip extension, and it should be resisted equally. One hand is hold over quadriceps to resist the hip flexion and one over the hamstring to resist the hip extension. We can see the video once more. This should be done simultaneously and hold it for a period of 5 seconds. This is the exercise. One hip is flexed and other is extended and it is resisted with both hands. And then ask the patient to repeat it just alternatively. That means the first hip which is flexed should be extended and the first hip which is extended should be flexed. In this particular position against resistance, again the patient should repeat it alternatively for a period of 5 seconds hold. And it should be done for number 20. 20 numbers should be done. This is the isometric knee push exercise, which is to be done actively and it should be resisted. One hip is flexed against resistance and other hip is extended against resistance, and it should be done simultaneously, which gives maximum strength to the sacroiliac ligaments. And the next exercise is modified SALABHASANA, in which both the hip are extended. Both hip are extended simultaneously, and then both the ankle is retracted towards both sides, and then it is kept together, and then flexion of hip is done to neutral position. This is the modified SALABHASANA. I repeat, both the hip are extended and then both the ankle are retracted, and then it is kept together to same place, and then it is kept in neutral position. It should be done in a number of 10. 10 numbers should be done. Both these exercises shall be started after 90-90 posture, and these two exercises are very much helpful in the pain management of sacroilitis. Hope you understood the video. Thank you.